Good afternoon or good morning to you, depending on where you are. Thank you so much for participating on this live webinar. My name is Jose Leon. I am the Chief Medical Officer for the National Center for Health and Public Housing. It's such a great pleasure to host this activity with two of our staff members, Chantel Moore and Fide Pineda Sandoval. Thank you both for joining us. And today we will be talking a little bit about diabetes resources for health centers serving special and vulnerable populations. Next slide, please. So some housekeeping items before we get started. At this moment, all participants are muted. The cameras are off, but if you would like to participate and engage with us, please turn your camera on. You can also use the chat box and you can send questions or comments. You can use the raise hand icon, and if you would like to be unmuted. And the webinar is being recorded, and the slides and the recording link will be sent via email within a week after session. Or you can also go to our website, nchph.org, go to our resource library and get all the slides and all the materials and resources that we are planning to share today. Next slide, please. The National Center for Health and Public Housing is funded by HRSA to provide training and technical assistance to health centers across the nation. We offer resources to health centers located in or immediately accessible to public housing, but the training and technical assistance activities are for all health centers. Next slide, please. Again, my name is Jose Leon. I am very pleased to be sharing this webinar with Chantel Moore, who is our communication specialist, and Fide Pineda Sandoval, who is our health research assistant. Next slide, please. So this webinar is, again, a live activity, and this is our agenda for today's webinar. We are going to identify PHPC, Public Housing Primary Care, National Training and Technical Assistance, and nonprofit and federal organization diabetes resources. We are going to classify diabetes resources by subtopic. We are going to list diabetes resources in Spanish and other languages, and list some pediatric resources and for healthcare professionals serving the homeless population. Next slide, please. Just a quick overview of the health centers close to public housing developments. This is the most recent data that we have. The source is the 2020 National Health Center data. And in 2020, there were 435 health centers located in or immediately accessible to public housing who serve over 5 million patients. 107 of these 435 health centers receive funding from HRSA to provide services to public housing residents, and in 2020 they serve over 800,000 patients. Next slide, please. In public housing, we have vulnerable populations, and for the purpose of this webinar is worth mentioning that 55% of those living in public housing have a less than a high school diploma, that 35% are over the age of 65, 25% are Hispanic, 37% of children. The only reason why I'm mentioning this is that this is something that we need to keep in mind when we are going to either develop materials, diabetes materials for our population, or if we are looking for materials, and we need to get into consideration all the health literacy issues that this population may have. Next slide, please. Diabetes is a great concern for those living in public housing. According to a recent publication from HUD and CDC, around 17% of those receiving assistance from HUD had diabetes, and 33.6% of those receiving assistance from HUD lived in public housing, according to the most recent data that we have from NHANES, the CDC survey, and the data that we got from HUD. Next slide, please. When we compared hemoglobin A1C, this is again 2020 data. This is a comparison between FQACs in general of the federal qualified health centers and those grantees receiving funding from HRSA to provide services to public housing residents. We see that the A1C is a little bit higher when you analyze the public housing primary care patients data. And the other item that we would like to highlight is that in public housing, almost 31% of those receiving services in public housing primary care sites are served in a language other than English. So this is extremely important. Even if you can get some resources in English, we also need to get and think about those who are served in another language other than English. And we are not talking only about Spanish, but there are other languages spoken in communities that are close to public housing developments. One example is in San Diego, California. We have one of the PHPC health centers, and they have over 10 languages that are spoken in that community. So that's something that we also need to keep in mind when we provide these diabetes resources to our patients. Next slide. So before we get into the nitty-gritty of our presentation, we have a poll question for everyone. And the question is, where do you get diabetic patient education materials from? So these are the options. We create our own materials. We got them from federal agencies or primary care association or national training and technical assistance partners, non-profit organizations, professional body, and we don't get diabetes material for our patients. So we're going to give around 30 seconds to respond to this question. All right, Fide, any responses?
Yeah, so far we have 33% of participants stated that they obtained their resources from nonprofit organizations, followed by 27% where they create their own materials, 27% obtain it from federal agencies, and 7% from our primary care association. Lastly, by another 7% where they do not get diabetes materials for their patients.
Excellent. Thank you so much for participating. And we are going to briefly discuss some of the options. Next slide, please. I will be providing some general information, and Chantel and Fide will be talking about some of the resources that we currently have as an NTTAP, as a National Training and Technical Assistance Partner. And since diabetes has been a priority for HRSA for the last 5 years, we would like to mention that NTTAPs and PCAs and all these organizations providing training and technical assistance are working and we are trying to develop materials for not only for patients, but for the clinical and non-clinical staff, providing services to the diabetic population. Next slide, please. If you are in the process of developing materials for your patients, or if you are looking or doing some kind of research, trying to find specific resources for your patients, there are some steps that we need to consider when we are looking for these resources. Either you are looking for information on nutrition and planning or weight control, or another option is medication and insulin, or physical activity, or information on how patient can self-monitor the blood glucose or manage the high and low blood sugar, etc. There are different resources on stress management, risk reduction, and problem solving. Remember that these patients are also affected by some behavioral health issues. In public housing, we have 1/3 of the population living in public housing who are current smokers. So we need to consider the other chronic medical conditions that can affect our population, and provide resources not only for our patient with diabetes, or just to think about diabetes when our patient has has other conditions that we also need to address. Next slide, please. Then the next question that we need to ask ourselves is, what am I looking for? Am I looking for fact sheets and toolkits? Am I looking for infographics? Am I looking for reports to share with my clinical staff? Or am I looking for videos and podcasts? So we need to make sure that we know the type of resource that we're looking at, so we can make a better decision or make a better search when we are looking for these resources for either patients or for the clinical or not clinical staff. Next slide, please. There are some steps that we have to consider. First, we need to decide where to start our research or search. I mean, if this is an internet search, many, if not all of us, use Google or any of the other software or applications to do some or these search engines to look at information. So the first step is either do I need something on the internet, or do I need something? Can I do a search and use anything else that is not the internet? Next slide. Our next step is we need to look for subject-specific database. Again, we need to note specifically that the topic that we are trying to find information about. The most current or the most popular searches when we are trying to find material for patients with diabetes are nutritional resources or anything that is on behavioral interventions or exercise program for our patients. So we need to make sure that we know exactly what we're looking for. Next slide. The next step is, if I am unsure, or if I am looking for something, or if I need any help, you can also ask a librarian or a health educator. There are several diabetes health educators who can also provide some information on where we can find resources, and they are very helpful when we are trying to locate a specific videos or podcasts or fact sheets of infographic for our patients. Next slide, please. Next step is if we are doing an internet search, we need to choose our keywords carefully, and Chantel will talk about some strategies on how to look for these resources on the internet. Next slide, please. Then this is extremely important. Look for credible resources. These are some examples based on the poll results. We know that many of our distinguished health centers look at resources online, and they visit federal agencies such as the Centers for Disease Control and Prevention, or the Agency for Healthcare Research and Quality, or the National Institutes of Health. They also visit the nonprofit organization, the American Diabetes Association, or health NTTAPs, and specifically all the national training and technical assistants are working closely with the National Association of Community Health Centers, NACHC, and we have developed the Health Center Resource Clearinghouse, and Chantel will also be presenting on this website where you can also find some resources. And for clinical staff and non-clinical staff, you are trying to find some information or some training for your staff. The Diabetes Task Force has also created a website where you can find webinars on some diabetes subtopics, or learning collaboratives, or publications, or other resources for your staff. Next slide, please. The next step is to evaluate credibility. Make sure that all the resources that you got are from either a .edu or a .org or a .gov, because these are credible resources. I try to, when I look for resources for patients, I try to stay away from .com resources on the internet, because we don't know whether or not these resources are good resources for patients, or if the information that is provided is accurate. So the recommendation is to look for .edu, .gov, or .gov resources, just to make sure that what you are providing to the patient is credible and it comes from authoritative sources. Next slide, please. The next step is compile resources and build your own archive. It's extremely important. If you find something that is something that you can use, so try to keep your resource library and then update the information. Some of these resources online can be modified or recreated. CDC, for instance, has a disclaimer that if you take some of these informations and somehow you would like to modify it to adapt the research for your audience, the only thing that they ask you for is to cite the source. In this case, Centers for Disease Control, and you can recreate what they have and just add that all the information is coming from CDC. Next slide, please. So I will briefly talk about the federal and nonprofit resources that we use and that we promote to the public housing primary care grantees. The very first one is NIDDK, the National Institute for Diabetes, Digestive, and Kidney Disorders. And if you go to this website, which is an NIH institute, you can go to health topics, and from health topics, you can select diabetes. You will be directed to a page with resources for professionals and for patients, where you can find videos and blogs and all kind of information related to diabetes that are extremely useful for patients and for clinicians. They also have some other topics that are subtopics for patients with diabetes. They have a publication on structural racism, for instance, or health equity that somehow are related to the diabetic population that we serve. Next slide, please. ARC, or the Agency for Healthcare Research and Quality, also has extremely good information. And if you go to topics, there is a to C list where you can select diabetes. From there, you can find resources for patients as well as for clinicians. And they have also resources in Spanish, and Fide will go over those resources. But if you are creating your own materials, and I saw a very good percentage of you creating your own materials, they also have some health literacy publications where you can see whether or not the your publication is any time that you are creating a publication, this publication has to be for patient at the 3rd grade level, and they have excellent resources just to check that your publications are going to be understood by your patients. Next slide, please. The Centers for Disease Control and Prevention, plenty of information you can find here on diabetes for professionals and not professionals, even information on self-management or information on prevention, on nutrition. So this is another good resource that I am quite sure that most of you are familiar with. But they are one of the good things about CDC, as I mentioned, is that you can modify the resources, and they ask you just to cite the source. And this is something extremely useful, and the information is being updated frequently. So all the information that you get here is up to date. Next slide, please. The American Diabetes Association has different resources for patients, and they have a table of contents. This is a screenshot of the main page. And if you scroll down to resources, they have a drop-down menu where you will look for medical practitioners. And if you go there, they will have another table where you can find patient materials, which is the last option. And the only thing that you have to make sure is that you create an account with them. All the most, if not all, of the resources for patients are free of charge, but you need to create an account. They keep data and metrics on the number of people visiting the websites, and this is the way that the only way that they can keep the metrics and making sure that they get all the information of all visitors. But the patient materials are free, and I use it a lot. And if we go to the next slide, please. They have different resources. In this case, this is a resource for eye exams or for people with diabetes, and it's a fact sheet that you can share with your patients, and it's extremely useful, very easy to read, and it has just like 2 or 3 main topics that they cover. And again, I mean, you have resources for all kind of complications, or if you are looking for resources, in this case for patients, you know, for eye exams for patients, or they have another tool that is free, and is to check whether or not you are at risk of developing diabetes, and they have a diabetes calculator that patients can use and make sure, you know, or at least try to see whether or not they are a high risk of developing diabetes. Next slide, please. So this is a general overview of federal agencies, and I'm turning over to Chantal Moore, who will be providing some information about the resources that NTTAPs and other organizations providing training and technical assistance have for health centers in general. Good afternoon, Chantal.
Thank you, Jose. I want to open up with a brief poll question. Do you know what Boolean searching is? Okay, Fida, could you show the results, please?
Yeah, so 85% said no, they don't know, and 15% said yes.
Perfect. Well, I'm about to help make your life a little bit easier. So can we go to the next slide, please? Boolean searching is something that can be used in any search engine. It is a search method that helps users find results in a quicker and precise fashion. They use logic-based words such as and, or not. And these words can help narrow or broaden your search results. Next slide, please. So listed below are some Boolean operators that help you narrow your results. So the word and, if you type it in all caps in between words when you're searching, what it will do is it'll instruct the search engine to only bring back results that contain both search words. So for an example, Fida, can you go back one slide? If you notice, it's a little bit small, but the photo on the right at the very top where you're searching, it says diabetes resources and nutrition. And then if you look at the very first result that's circled, you see diabetes is highlighted in bold, and then the title is recipes and nutrition. So that's just an example. Fida, could you advance to the next slide, please? The next word that you could use is not. If you do that, it instructs the search engine to not bring back any results that contain a specific search word. So for an example, if you were to type in Microsoft Word not working, just all lowercase, then it's going to show you things that say Microsoft Word not working, troubleshooting, help. However, if you were to type in Microsoft Word not in all caps working, then it's going to automatically omit certain those types of words whenever pulling up your search engine. And this is very important to know because in today's society, we like to have things fast. And typically when you search for something on Google, you like to find it on the first page because you're typically creating materials for patients and you're trying to be conscious of time. So these keywords are fairly important. Fida, next slide, please. Now there is one search term that can help broaden your results, and it is the word or. So with this particular operator, it commands the search engine to bring back results that contain either one search word or the other. So it'll bring back some results that contain either word. So this will help you bring back more results if you're not looking for anything very specific. So for an example, if your search topic word has a lot of synonyms and you're unsure of which one will be used in the documents that you seek, it's a good option to use the word or. And now sometimes it is necessary to use parentheses in conjunction with the word or in order to get the search to run correctly. Next slide, please. Next, I will discuss our National Training and Technical Assistance Partners. So with National Training and Technical Assistance Partners, they provide free training and technical assistance to support existing and potential health center grantees and lookalikes. One example of this is the Special and Vulnerable Populations Task Force on Diabetes, and their website is www.chcdiabetes.org. Next slide, please. So here's just a little bit of information about the Diabetes Task Force. It is comprised of 14 national training and technical assistance partner organizations, and what we do is we engage health centers, primary care associations, and health center control networks to help increase knowledge of effective strategies that address diabetes among people experiencing homelessness, residents of public housing, migratory and seasonal agricultural workers, school-age children, older adults, Asian Americans, Native Hawaiians, and Pacific Islanders, the LGBTQIA population, and other health center patients. Next slide, please. So on this website, for the Special and Vulnerable Diabetes Task Force, they host learning collaboratives and national learning series webinars, and they also contain supplemental resources. Every fall, they conduct a national learning series, and in the spring, they conduct learning collaboratives, and they have those resources available. Next slide, please. So this is one example of the resources that they offer in regards to the National Learning Series webinars. They can be found at the bottom of the National Learning Series page. So whenever you're on the home page, if you look at the top navigation bar, you can click on National Learning Series, and then this, like the information like what is shown in the picture, should appear. Next slide, please. Another resource that is credible is the Health Center Resource Clearinghouse. It was established by the National Association of Community Health Centers, and this resource addresses competing demands of public health professionals by providing resources and tools to acquire and use targeted information daily. So this clearinghouse has a lot of materials, very robust, and it has and there are lots of ways to help find information easier. Next slide, please. Okay, so the website for the Health Center Resource Clearinghouse is healthcenterinfo.org. Some of the resources on the Health Center Resource Clearinghouse include, but are not limited to, learning collaboratives, webinars, and publications, all published by national training and technical assistance partners. Next slide, please. This fall, the Health Center Resource Clearinghouse made updates to their website, such as a new search bar on top of the page, where you can easily search for material instead of having to go through some things. And you can also use Boolean logic while searching to help narrow your results. They also have a learning page, which is in the top navigation bar, and you can view many different resources such as self-paced learning modules, podcasts, previous webinars, and learning collaboratives. Next slide, please. They have also added a new searchable database for learning collaboratives. So for an example here, in this photo, I've accessed the searchable database and I've circled diabetes because you can search by subject, you can select organizations if you're trying to find information specific to organizations. Next slide, please. Now, listed below is just an example of the results from a search for diabetes related materials. So in the top right corner, I typed in diabetes, and these are some of the first few articles that came up. Once again, feel free to use Boolean logic if you want to help narrow your search, because there are some things that search engines do not contain, even if they are relatively advanced. Next slide, please. So next, we have a poll question. Which of the following items listed below is not a new feature on the Health Center Resource Clearinghouse? A, the search bar at the top of the page. B, the ability to find things by subject. C, a searchable database for learning collaboratives. Or D, a learning page on the navigation bar of the website. All right, Fida, could you show the results, please?
Yep. So majority of you were correct. The correct answer is B, the ability to find things by subject.
Thank you, Fida. And I will turn this over to Fida for our next discussion.
All right, thank you so much, Chantel. So next we're gonna basically do like an overview of some diabetes resources that are available in other languages. So as Dr. Neon mentioned at the beginning of the presentation, about 31% of PHPC patients are best served in a language other than English. So this reinforces the need that we have to provide diabetes resources in other languages that are readily available to patients. So in this slide, we have our first set of diabetes resources in Spanish. And over here, we can see that we have, you know, an example of diabetes health information, which contains information in Spanish by the National Institute of Health. We also have another resource called by the Diabetes Educator Spanish Resources. And this page basically contains resources for patients on healthy eating, being active, taking medications, monitoring, and more. It also contains resources on diabetes peer support groups, tips for healthy holiday eating, diabetes checklist, and more. And of course, you can't miss the CDC's diabetes website, well, they also have resources in Spanish. And over here, we have an example of some of like the flyers and some questionnaires that are provided in Spanish as well. So in this slide, we have this fotonovela, which is provided by the Migrant Clinician Network. And this fotonovela aims to provide diabetes education and awareness. It takes us through how a woman discovers that she has developed type 2 diabetes with her emotions, what her emotions and lifestyle changes have been after she discovered that she got diagnosed with diabetes. And this fotonovela is provided in Spanish. All right, and then for Spanish diabetes resources, over here we have examples of what a diabetes flipbook looks like. And these are basically similar to the pamphlets that are usually shared at a doctor's office, which contains diabetes information with images for visual understanding. And this resource is from a nonprofit organization called Casa de la Diabetes, or House of Diabetes, where more information of these flipbooks can be found in Spanish on diabetes, self-management, nutrition, exercise, psychology, and more. So over here we have basically just like an overview of what these flipbooks look like. And as you can see, they're very specific. They have a lot of imagery to it to help patients basically understand better what they're reading and what they're trying to understand. So here we have the guide for CHWS, and this is provided by the CDC as well. And this is geared to health educators, diabetes educators, and lifestyle coaches. And this is a resource for Spanish-speaking audience with a low literacy level. And the usage for this facilitation guide is basically you can use it as a source of information for your community and for small group discussions. So next we have this resource by the Agency for Healthcare Research and Quality. And this resource basically provides a whole list of video novellas, or kind of like soap operas, or just videos basically showing a story of how one lives with diabetes. And it educates the audience on diabetes, the importance of taking medications on time, and having good communication with your medical provider. And over here, the link is provided in the slide deck, which we're going to be sharing with all of you after the session. But basically, you'll have access to the YouTube video channel by AAPCHO in Spanish. My apologies. So here we have diabetes resources in other languages. So we know that in public housing we have there are patients that don't only speak Spanish, but also, you know, they are from other countries. So here we have some resources where you can basically visit and access information on how to draw up one insulin, or how to use an insulin pen, and how to mix 2 insulins also in multiple languages. So all of these instructions are provided in many other languages as well. Then we also have a CDC resources page in languages other than English. And we also have another resource from the National Institute on Minority Health Disparities, Diabetes resources, which are other resources provided in Spanish and in Asian languages. And then over here, we have some other websites also that contain information for patients and educational resources in several other languages, such as Arabic, Bengali, Gujarati, Turkish, and more. And one of the cool things about this resource, whenever you access it, is that it also provides some information. So for example, for patients that speak Arabic, how they can manage their diabetes during Ramadan. So that is one of the cool things about these, that is very culturally competent. It's a very culturally competent resource. So next we have some resources on pediatric diabetes. And over here we have a resource provided by the American Diabetes Association. And what this aims to do is that it aims to help children get more involved and learn how to manage their own diabetes at an early age. And what this consists of is a camp program that helps teach children independence and develop self-confidence while being surrounded by support groups. And upon accessing the website, you'll see that the sign up for Camp 2022 is now available through their website. So through this resource by the National Institute of Diabetes and Digestive and Kidney Diseases, this resource serves as a clearinghouse and health information center on diabetes health topics. Dr. Leon kind of went over it earlier, but it also touches base on health topics such as kidney diseases and anything that has to do with digestive diseases. And under the diabetes health topics, you'll be able to find diabetes and pregnancy resources, gestation, anything that is also related to gestational diabetes, preventing diabetes problems, and more, which are also available in Spanish. So over here we have an example of what some diabetes materials are available for the homeless population. So the National Health Center Healthcare for the Homeless Council provides materials that are geared to healthcare professionals. And over here we have an example of like some of the webinars that they have available. So right now there is very limited the amount of information that we have on the homeless population, but for patients. So this basically kind of brings us to what the next slide is about, on how to create, how you can develop your own patient education materials. So these are basically guidelines by the American Academy of Ambulatory Care Nursing, which aim to facilitate the development of patient education materials while keeping in mind limitations in health literacy that may exist among patients. So some of the guidelines include, to make sure that you use visuals as much as possible, choose books or pamphlets, use short sentences when developing printed materials. Also make sure that you use visual terms such as runny nose and redness, and more information is provided here. So next we have this resource by the CDC, which also serves as a guide on how to develop materials that are clear and understandable for your audience. and also walks through how to make your message clear for an audience with low literacy levels, also walks through how to create layouts and designs for your materials, and helps with how to create materials that are culturally competent for your audience. Okay, and I'm gonna pass it on to Dr. Leon to go over any questions and answers that you may have.
Thank you, Fide, and thank you, Chantel, for your presentations. If you have any questions, as we said in the very beginning, you can use the Q&A feature or the chat box, or you can also use the hand raise icon, and then your line will be unmuted. But before we get any questions, remember that the health centers serve different populations, so it's almost impossible to find one fit all kind of a resource for patients. For patients with diabetes, as Fide mentioned, most of the federal agencies recommend either videos or photonovelas. So some of these materials are very easy to understand, and through research, many of these people, or many of these researchers are trying to find the best way to educate our patients, have found that images and visual aids are really the best way to educate our patients. And then no more than 3 tips if you are creating fact sheets or if you are creating pamphlets. That's extremely important. And then use the teach-back method that all of you are very familiar with. So those are the recommendations of the takeaway, the take-home tips in regards to patients with diabetes and the educational materials that they need. And again, one of the websites that from a health education perspective that I like is the American Diabetes Association. The only, as I mentioned earlier, the only thing that you have to do is to create an account. The materials are free. You don't have to pay for the materials. They are in PDF format, and you can download and print as many as you want. Do you have any questions, Phil?
No questions at the moment.
As Chantel also mentioned, the Health Center Clearinghouse is another site where you can find materials. This is a NACHC website, and it's being shared or helped by other NTTAPs providing all the materials. So if you are looking for something on public housing, for instance, you can go to this website, and then after your search, you will be directed to any of the NTTAPs providing a training to health centers serving public housing residents. The same for the other special or vulnerable populations. Is extremely useful for staff, and even though there is just a few resources for patients, it's a really good place to start your search. And if by any reason you cannot find anything, you can also visit any of these NTTAP websites and send them a request, and you will be contacted by any of these any of these NTTAPs to get the information that you need. So there are no questions. We can move to the next slide, please. So please complete the evaluation survey after this webinar is completed. We appreciate your time. We appreciate your feedback. And yes.
Sorry to interrupt. We do have a hand raised from Cassandra Smith.
Okay, please.
I am going to unmute you. Okay.
All right.
Hi, Cassandra.
Hello, how are you? My name is Cassandra Smith. I'm from Primary Care Health Services in Pittsburgh, Pennsylvania, and I'm the Diabetic Care Manager. My concern is when I was looking at the materials that are available, I have, you know, a lot of patients, well, several patients, that they are, you know, illiterate, and I have difficulty, and the staff have difficulty in trying to explain diabetes to the patients. Now, this there is resources available that I can obtain so that, you know, we'll be able to help our illiterate diabetic patients.
Sorry, Cassandra, you broke up a little bit. Can you just repeat the last part of what you said? I'm sorry.
Yes, is there material available that, you know, we can give to our illiterate diabetic patients and review it with them so they can understand about this disease?
Yeah, so just to make sure that I understood your question, you are asking whether there are some material for patients that probably do not have the knowledge to understand what diabetes is, and you are looking for that material since it's very hard to explain to these patients, right, what diabetes is.
Correct. They cannot, we have a few patients that, you know, cannot read at all. And I'm trying to help them with material, but I don't know where to find anything, even with pictures.
You know, that's a great question. And thank you so much for your question. Yeah, the best way when you have patient, I mean, the best material, education material that you can use for patients who cannot read is NIH and NIDDK have videos, you know, so a video explaining to patients what diabetes is. And if you go to the websites of these organizations, there is an overview of diabetes. And this is for patients, and these are videos that are not more than 8 minutes long, where they can understand the basics of diabetes. If the patient cannot read at all, I would recommend videos. If by any reason you cannot find them on any of the federal agencies websites, you can also go to Google, to YouTube, and find and just do a search, and you will find many videos on an overview on diabetes overview. But just again, just make sure that the video is coming from one of these credible sources, Cassandra. That would be my recommendation.
Thank you.
Thank you.
Thank you so much. Mm-hmm.
And we have a comment from Christine that the VA has some handouts as well. Thank you for that information, and you're totally right. You can also go to the VA website, and you will find some resources for diabetic patients. Again, there are several places where we can find resources for patients with diabetes, but the challenge for all of us is to make sure that these are credible sources, and that we are looking for something that is very specific to our patients, like what Cassandra mentioned. That I mean, you can have plenty of resources In fact, it's an infographics, but if the patient cannot read, or if the patient has difficulties learning what diabetes is or what other chronic medical conditions are, you know, most of the time we have patients with diabetes that also has only other chronic medical conditions. They have hypertension, they have other issues. So these materials are not only specific for diabetes, but for other chronic medical conditions affecting patients with diabetes. I don't see any additional questions, so thank you so much for participating and providing your feedback. And again, next slide, please. Please complete the post-evaluation survey. And you can also contact us. These are our contact information. You can contact me, or you can contact Fide or Chantel for additional information. Those are our email addresses. Next slide, please. And you can also go to our website, nchph.org. And if you have any additional questions, you can email me, or if you would like to make any comments, or you know any resources, or you would like to share your resources with us so other health centers can use them, please feel free to do it. And we will make sure that we send it to our audience. Thank you so much for your participations, and happy holidays.